Good morning or good afternoon, everyone. Welcome to today's webinar. We will start in just 2 minutes. We'll give folks another few moments to join us, and we'll begin. Okay, well, why don't we go ahead and begin. Good morning or good afternoon. I'd like to welcome everyone to today's webinar, Tobacco and Cancer-Related Health Insurance Benefits in Marketplace Plans, preparing for the 2018 open enrollment period, which is coming up soon, November 1st through December 15th, 2017. My name is Paul Baker. I'm the Senior Director for Programs at the National Alliance for Hispanic Health, also known as the Alliance. The Alliance administers the Nuestras Voces, or Our Voices, National Hispanic Network to reduce tobacco-related and cancer health disparities. The Nuestras Voces Network is one of 8 national organizations funded by CDC's Office on Smoking and Health and CDC's Division of Cancer Prevention and Control to operate national networks to serve specific populations experiencing tobacco and cancer-related disparities. One of the functions of the network is to facilitate relevant tobacco and cancer control-related webinars and other trainings for the public health community and other Hispanic-serving stakeholders to increase awareness and education on proven strategies and interventions. If you haven't done so already, I really encourage you to go to our website, which is nuestrasvoces.org, and register as a member of the network so you'll be sure to receive our updates and announcements. Once you're there, just click on Join and fill in the registration form, and then look for a follow-up email to confirm your registration. Our network, just very briefly, partners with 11 sub-network lead agencies that serve as regional network representatives around the country and work with Hispanic-serving partners, organizations, and other stakeholders located in states within their National Center for Chronic Disease Prevention and Health Promotion regions. The network's main objective is to build Hispanic community infrastructure and increase regional and national partnerships to decrease exposure to secondhand tobacco smoke, increase smoking cessation, increase cancer prevention, and improve the quality of life for those living with cancer in the Hispanic community. Today we'll be focusing on health insurance and insurance plan benefits, and this is especially relevant for the Hispanic community, which remains the largest group in the United States without health insurance. While health insurance rates have certainly improved for Hispanics since the years before the Affordable Care Act was implemented, we still have large disparities among Hispanics, as we see here in this slide for those ages 19 to 64 years of age, it's estimated at somewhere around 22%, compared with non-Hispanic whites around 8% in 2016. At this point, it's my pleasure to welcome our guest presenter, Jeanette Contreras. Jeanette is a health insurance specialist in the Office of Communications at the Centers for Medicare and Medicaid Services. In her position at CMS, Jeanette focuses much of her time building dynamic partnerships with a variety of national and regional stakeholders around the country for collaboration on outreach and education about healthcare programs and policies, including Medicare, Medicaid CHIP, the Health Insurance Marketplace, and the Affordable Care Act. Today, Jeanette will talk to us about government health insurance plan options, in addition to the insurance plan benefits related to smoking cessation and cancer prevention. After she concludes, I'll provide some information on an alternative resource for affordable healthcare services, and then we should have time for questions. Actually, if you have questions during Jeanette's presentation, feel free to use the chat box on your screens and make sure that you specify to whom you're sending the message. And Jeanette will try to answer those questions during the presentation, and if not, at the very end. The information we're sharing today is especially important for promotoras and other community health workers who provide insurance navigation services in Hispanic communities. Not only is it crucial to understand and communicate to communities that the ACA still is the law of the land, despite the political maneuvering on Capitol Hill, but also to know how the various health insurance plans work, how to enroll as easily as possible, and what the plans provide. Plan benefits are especially important to know, for example, for someone with a history of cancer in their family. So they know that preventive cancer screenings can be utilized through their plan. Likewise, for some folks who are smokers and want to quit, or who know they will want to quit at some point, it's critical for them to be aware of the smoking cessation services provided as one of the benefits of their insurance. So, without further ado, Jeanette, thank you so much for being here today and sharing this valuable information with us.
Thank
We're going to switch over control to you right now. Thank you.
Okay, great. Thank you. It's my pleasure to be with you all this afternoon, and thank you all for your interest in the topic and for helping to educate yourselves, to help educate your communities about preventive services and health coverage options. So I have put together an agenda for what I'm going to talk about today, and it's kind of like a conversation we're going to have using the Coverage to Care initiative that we have here at the Center for Medicare and Medicaid as a guide. This is so we're going to talk about how to use your health insurance and understand your coverage benefits, particularly what preventive screenings, what preventive services and cancer screenings are available, and the different tobacco cessation coverage options in Medicare, Medicaid, and the health insurance marketplace. And throughout, I'll really just share resources that you can share with your communities throughout, and how you can get involved in health care outreach and health promotion outreach. And then we'll end the discussion and leave plenty of time for questions and talking about health insurance options for immigrant families in the health insurance marketplace, and if in other coverage options for other types of families. So I'll start out by just giving you a brief overview of this initiative. So the From Coverage to Care campaign is really a great resource for all our beneficiaries, be it Medicare beneficiaries, Medicaid, and CHIP, the Children's Health Insurance Program, but families, and the marketplace consumers that are new or may be new to health coverage. Most of you know, I think, that there is a national conversation happening around what is health insurance, and do we need it, and what's going on. And so this is actually a really neat tool that helps explain what is health insurance, how to navigate having it, how to understand how to use it to get your primary care and the preventive services you'll need to stay healthy. It comes with really cool toolkits, the nice consumer tools on what to look for, what does the insurance card have, a pull-out guide for what's the difference between primary care versus emergency care. It explains the explanation of benefits, which is sometimes looks like a bill that you're getting from your health insurance company. There are pull-out step booklets, and the large booklet, or the majority of the stuff is the pamphlets and the tools are available in 8 different languages. There's also a tribal version and a customizable version for any maybe community-based organizations or maybe health departments that want to go ahead and put their information in. There's a space provided in like the first page and first 2 pages of the booklet to go ahead and customize those. Last year we launched this 5 ways to make your most of your health coverage. This campaign's been going on for a few years now, and each year we build on it. And this is a nice infographic and a poster that really just, I think, is the best way to introduce the Coverage to Care campaign and the Coverage to Care initiative. It basically covers the main points we want our consumers and beneficiaries to know. The first thing you should do is confirm your coverage. You know, if you're enrolling in a marketplace plan or if you're going to your state Medicaid office to enroll, make sure you understand you've got your plan number, you have your card. Make sure that you confirm your coverage, and make sure you pay your premium if you have one, so that you don't lose your health coverage or forget to make a payment and then lose your health coverage. Second, know where to go for answers. So know how to find the number to contact your health plan to see what services are covered. Understand and you know where to call when you have questions about the billing or any costs associated with receiving care. Also, we have the roadmap to better care and a healthier you, which is like a poster which talks about the key health insurance terms like co-insurance and deductible. So as you know, health insurance can be complicated. So we hope that this tool helps to really make it easier to understand and help people be more informed about what health insurance is. Number 3 is find a provider. So it can be no easy task to find a doctor within your network that may be nearby or with you or that you like. It goes through really just how to help empower the consumers to know what to ask for, know what to look for when they're finding a provider. Either you can call your health plan or go online in most cases and search for providers in your network. But you know, you don't want to just blindly pick somebody. You know, yes, it's nice if they're conveniently located for you to get to, but if you have a few more options, it'd be nice to maybe, you know, call and ask to speak and ask questions about the doctor before you make an appointment with the provider for your first one. And remember, you might pay more if you see a provider who's out of network. So this tool helps to go into more detail on that. Know what to expect or what you need in advance of making an appointment. And make sure you have questions in advance, questions ready when you talk to your provider. And this piece also talks about the preventive services that are available. You want to make sure that you get done when you see your provider and have your referral set for your mammogram, for example. And number 5, fill your prescriptions. So it's important to know if the drugs that you need, the medication that you need, is covered and at what your actual cost, your out-of-pocket cost will be for the prescription drugs. If you have a copay or if you have co-insurance, and is it in the first tier or second tier formulary. So yeah, filling your prescriptions seems easy, but it can be a lot to consider, especially when we're figuring out the cost of your prescription drugs. So it's really important. This guide talks about step 1 in the roadmap of the 8 steps is to put your health first. So it talks about maintaining a healthy lifestyle, getting your preventive screenings, and so that's what we're going to focus on for the first part of the talk today. Of course, having health insurance is important. It is, you know, probably the first step, but there's no substitute for a healthy lifestyle. So even if you get 10 minutes of activity a day, it's better than nothing. I wanted to share some resources on where you can get ideas for some, like, for example, physical activity basics or how to be active your way. These are nice resources from the CDC, the Center for Disease Control, and www.health.gov that provide some guidelines. Sports and running, and it's not for everybody, but there are great ways that you can incorporate things like working in your garden or dancing or taking brisk walks to help get physical activity in your lifestyle. And hand in hand with that is, in putting your health first, is healthy eating. So again, a healthy diet is really critical because it can actually help to protect us from heart disease, diabetes, or cancer. So it helps to lower your risk factors for the preventable diseases like heart disease and diabetes, and really helps lower your risk for the different cancers. So this is really important. Here again are some resources from the choosemyplate.gov, and I think this is from the USDA. I don't think it's HHS. It might be HHS, but and then there are nutrition basics are from the CDC again, which is from the Centers for Disease Control. As one of the nice additions we created to this Coverage to Care campaign is we put together a series of infographics and posters around putting your health first. So these are our Preventive Services resources and guides. And you'll see on this poster, it's got broken out in 4 different steps. So 1, make time for physical activity, healthy eating, relaxation, and sleep, which I can never get enough of. And 2, get the preventive services that are right for you, and we're going to talk about those today and what your benefits are. And then 3, take an active role in your health care, and 4, keep track of your health information. And we really think that the Coverage to Care guide and those materials really help to empower our beneficiaries and consumers on how to really take an active role in your health care and to understand, because the more information you have and the more understanding you have about how health insurance works, the better advocate you can be for yourself when you're accessing services and interacting with the health insurance companies. So preventive services, so we're going to switch a little bit of our talk over to what preventive services are covered. So most plans, including marketplace plans, must cover a set of preventive services like your vaccinations, your shots, or the different preventive screening tests at no cost to you. So this means that their preventive services should be given without a copay if you have one, or without coinsurance, even if you've already or haven't yet met your yearly deductible. So at no cost to you means no out-of-pocket cost for these. So the recommended screening guidelines and what most health plans offer are, these are the preventive screenings, I should put cancer screenings for adults. So I just took out the cancer screenings here for you. So colorectal cancer screenings for all adults over 50, this should be covered. And the caveat here is that if these are ordered or delivered by a doctor or a healthcare provider in your network. So if you go out of network, it might not be free, maybe might be, but so again, you want to be mindful of you're doing this within your network, you're wanting to avoid having to pay coinsurance or co-payments, so go in network and make sure that your doctors ordered these screening tests for you to have. And lung cancer screenings are recommended for adults ages 55 to 80 who are at high risk for lung cancer because they're heavy smokers or have quit in the past 15 years. Tobacco use screening for all adults and cessation interventions for tobacco users is also covered. And prostate cancer screenings for men over age 50 is one that's also covered with no cost. So the preventive screenings for women are sort of, they do merit a whole slide on their own. So we get breast cancer mammography screenings every 1 to 2 years for women over 40. Breast cancer genetic test counseling for women at higher risk, so that BRCA counseling is a preventive screening for women. Breast cancer chemoprevention counseling for women at higher risk, that's also covered with no copay or cost. And cervical cancer screening for sexually active women. And then there's an expanded tobacco intervention and counseling for pregnant tobacco users. That's recommended. So the Coverage to Care campaign has these slides set up, or these infographics and posters available for your use, this is a good look at one that for all adults. You know, here it explains that these are the preventive service available at no cost to adults under most health coverage, thanks to the Affordable Care Act. So this includes Marketplace, Medicaid, and again, most private health insurance plans. We have a whole host of these preventive services flyers. We have them for men, for teens, for children, for infants, and for women. So these are available online for download, or you can order them through our product ordering warehouse, which I'll show you how to order those later. This is a nice one that talks about screening for women's cancers, just specifically, and a screening guide for pregnant women. So what to know during your pregnancy, what you need to be screened for during your pregnancy. That's the second flyer there. So now switching gears to talk a little bit more about the tobacco cessation screening benefits. So just to give you a little bit of data, because I'm a data geek, is that according to a nationwide survey of 27% of adult Medicaid beneficiaries report the use of tobacco, with 17% using tobacco every day and about 10% using tobacco on Sundays. So we have a pretty decent size of adult Medicaid beneficiaries who use tobacco. Among those who reported tobacco use, 74% reported being advised by a health provider to quit, which is good. So, you know, I would say 95% would be better, but 74% is good. Approximately 44% reported that their health provider recommended medication to assist with quitting smoking or using tobacco, and approximately 39% reported that their health provider recommends methods other than medication, for example, referral to a tobacco quit line to assist with quitting smoking or using tobacco. Let's look at your Medicaid tobacco cessation benefits. So this chart breaks it down by eligibility group and the benefits that are broken down. So for pregnant women here at the top, thanks to the Affordable Care Act, you are required to cover counseling. You're eligible for coverage of counseling and pharmacotherapy for the cessation of tobacco use by pregnant women. For all adults, effective January 2014, tobacco cessation drugs were no longer excluded from coverage. So that was a big win, I think, for all consumers and helping people quit smoking or to stop using tobacco products. And here it says states may, so this means it's an option. They may cover counseling for all other Medicaid beneficiaries through the benefits categories discussed below. And you'll see the links to the specific guidelines down at the bottom here. So if you want to look and refer to Medicaid.gov, or if you want to refer to the regulation, it's there down, the links are on the bottom. So for adolescents, your Medicaid would cover medically necessary tobacco cessation services, including both counseling and pharmacotherapy for children and adolescents. And it's mandatory under Medicaid's early and periodic screening, diagnostic, and treatment benefit, so the EPSDT. Sorry about the acronyms, but they're there. And for those that qualified for Medicaid under Medicaid expansion, which was all single adults, and this is part of the Affordable Care Act, Medicaid will cover counseling and pharmacotherapy required as part of the essential health benefits. So this was one thing that, again, thanks to the Affordable Care Act, is now covered by Medicaid. Medicare also has some wonderful smoking and tobacco use cessation benefits, so particularly when it comes to counseling. For example, here Medicare Part B covers up to 8 face-to-face visits in a 12-month period, so these visits must be provided by a qualified doctor or other Medicare-recognized practitioner. Anybody with Part B, who uses tobacco is covered and is eligible. And you should pay nothing for the counseling if your doctor or other healthcare provider accepts that assignment. So if the provider accepts Medicare, you get that for free, and if your provider orders it, you get it for free with the original Medicare. And this goes the same for Marketplace plans as well, so pretty much similar to Medicaid and Medicare. So as we go through all of the caveats, it really is important that you, for example, here, the third bullet, know the difference between in-network and out-of-network insurance. This is, key to everything, to understanding your out-of-pocket costs. When you understand the key insurance terms, it sort of demystifies when you look at your bills and when you look at everything, you read all of the documents that your insurance company sends you. So here is just the step 2 in the coverage to care resource is understanding your health coverage. So review your plan and to see what services are covered. And so we talked about the preventive services that are covered, but all marketplace plans and all Medicaid plans pretty much cover these qualified, these essential health benefits. So these essential health benefits are everything from, and I'll just maybe go through a few and not read them all, but the ambulatory patient services, emergency services, maternity and newborn care, mental health and substance use disorder services, including behavioral health treatment, which is really critical now as the nation is facing an opioid crisis. Prescription drugs, of course, and the preventive and wellness services and chronic disease management, which is really, really critical. And of course, with all of the pediatric services and all the pediatric plans on the marketplace and in Medicaid and CHIP, all children automatically get oral and vision care. It's not something that's automatically included for adults, but for children, we put that in there as oral and vision care is mandatory. We want to make sure our children are getting the full benefit of having health insurance. So a big part of understanding your health coverage is, again, understanding those terms. The premium, that's the monthly payment you make, the deductible, it's the amount that you have to pay for services before your plan starts paying. Your copay, which is that fixed amount that you might pay when you go to see the doctor, for example, like $15 for a doctor visit or $25 for a specialist, And then the co-insurance is the part where you share the cost with your insurance plan. So if, and this happens in Medicare, traditional Medicare, if you go to have an inpatient procedure, sometimes you pay 20% and Medicare will pay 80%. Yeah, so it's important to understand your health coverage and its cost implications. So this year we launched in January a new tool which is called Manage Your Healthcare Cost, and it really now talks about health insurance as a financial decision and how to budget for it in your household income, your household budget, and really it goes along with the message of making health insurance a priority, and knowing your healthcare costs will help you, be able to budget for it and make sure that you're, taking advantage of everything your health insurance offers, especially all of the free preventive services, and budget for those. Step 3 is know where to go for your care. For example, the primary care is definitely preferred over emergency care. We have a guide that talks about the difference between emergency and primary care, and some of the considerations to think about are not just the cost, because your copay or your coinsurance might be higher if you go to the emergency room, but also you won't be seen right away. So, if you can make an appointment with a provider, you won't have to wait to see the provider in the emergency department. Another consideration is that your primary care provider will have your health records, whereas if you go into urgent care or the emergency department, they aren't going to have your records, and so you're going to have to sort of make sure that you can explain everything and make sure you don't get prescribed something that you don't need or something that counteracts or get treated for the wrong thing. So there are lots of things to consider there. We have wonderful resources and great ways for you all to share this information with your communities. I have just highlighted a few of the steps in the roadmap, and a few of the slides that I showed you came from this community presentation that you can download. It actually has like the slides and the script that you can read from and make it your own, because it can be really lengthy. I wouldn't be able to do a talk in 45 minutes if I had to read through every single word of that script, which is probably a 2-hour read, and but you can definitely get what the information you need from there. We have a great, easy, what I call like a cool address, URL address or website address to find the information at. It's go.cms.gov/C2C, and that's what we call it, from coverage to care, because we, of course, need to have another acronym, create another acronym. C2C is what we call the coverage to care initiative, and you can go there and download everything. We have everything, again, available in most things in 9 different languages, and the majority in Spanish. So if you see on the screenshot here, you'll see the little icon that says Español, so you can go ahead and click over, and the whole site will come out in Spanish, and it's actually done pretty well. So that anything that's linked to in Spanish will give you Spanish content. So we're doing really well on that. All of those preventive services flyers, these presentation slides, all of this information that I just sort of previewed for you, you can find and order to have shipped to you directly for free at no cost, because we are the federal government and we have these resources, and we want to make sure that they get into the communities, and they don't do anybody any good sitting in our warehouse. So please don't be shy. Go to our website, create an account so that you can go ahead and order and replenish whenever you run out. And I'll note that each of the items that I showed you, like the different flyers, will have a product number in the bottom right-hand corner or in the top left. So you'll have to look for the product number, which makes it a little easier to order. You can search by name, but each of these resources will have a product number, and you'll be able to order it from there. So let's now, as we go into the last 15 minutes of the talk, I want to spend the rest of the time talking about the health insurance marketplace and what immigrant families need to know about coverage. So again, as we're talking about the national debate around the Affordable Care Act, most of you know, the Affordable Care Act is still the law. It will, we are about to go through another open enrollment period for people who want coverage for the calendar year of 2018. So this is for people who will need coverage January 1st, 2018 through December 31st, 2018. The open enrollment period this year will be 6 weeks long. So we have 6 weeks to enroll folks. There's no time to waste. If you know somebody who needs to get covered, you tell them, go ahead and enroll right away. Don't wait till the last minute. Get it done before you get your Christmas shopping done. The dates are November 1st through December 15th. And, most other health insurance, like my employer-sponsored health insurance, gets renewed every year. And, every year, even our Medicare open enrollment is every year in the fall. So that all those coverage determinations, your choices and selections are made in advance of January 1st, so that when you start January 1st, you have your coverage in place and everything's set up. So this is why they do it a little bit in advance of January 1. But outside that open enrollment period, you have the opportunity to enroll if you have a special enrollment period, if you have a qualifying life event, like, for example, if you lose other health insurance coverage, or maybe you lost your job or you lost your employer-sponsored health insurance, then you would be eligible to go to healthcare.gov and sign up for a special enrollment period. So we have a screener tool there. It's healthcare.gov/screener. You can also do it in Spanish at cuidadodesalud.gov and go through the screener as well. Anytime there are some major changes in your household size, like you get married or you get divorced or you have a new baby, you'll want to report those to the marketplace if you have a marketplace plan. Or if you need coverage, those are opportunities if you, for example, want to add a spouse or remove a spouse from your coverage. Anytime you move or have a change in residence. And there are several different other qualifying life events that you can look at, but I always have to remind folks here that to remember that you can apply for Medicaid and CHIP coverage at any time. We say, like, #enroll365 you just need to go directly to your state Medicaid agency or through healthcare.gov to get screened to know if you want to know if you're eligible for Medicaid or the Children's Health Insurance Program. Now, not all families are really simple, and maybe a lot of immigrant families have members of mixed immigration status within their families. We even have multi-generational households. So we talk about immigrant families as sometimes having mixed status families. So here, this is why we talk about it. I know mixed status is kind of a strange term, but so we call this options for mixed status families. We want to make sure that eligible members of those families are getting the coverage that they need and the coverage they're eligible for. And you can absolutely, use one application to maybe get Medicaid for a child and Marketplace for an adult, or, healthcare.gov is just a great platform to use to go through and find out what you're eligible for in terms of coverage. Some of the caveats that you want to remember is that families who aren't applying for health coverage for themselves won't be asked if they have eligible immigration status. So all of the information that you put in there is basically around the person that's needing the coverage. If you're just there as a person, the head of household, you just sort of list yourself as you're the head of household. This is, these are your family members and their information because they're eligible. So we want to make sure that most folks know that one, all of the information that they put into the application is also confidential, and it's not going to be used for immigration enforcement purposes. I also want to note that for Medicaid, if you are not eligible or if you don't meet citizenship and immigration status requirements, Medicaid provides payment for the treatment of emergency medical condition for individuals who visit the emergency room or have an emergency medical condition. Most people know it as emergency Medicaid. Some states are offering Medicaid regardless of citizenship or immigration status, and so that's kind of a state-by-state basis, but you're welcome to visit your state Medicaid office or inquire with your state Medicaid office around eligibility. And as I was alluding to earlier, the disclosure of immigration status tends to be a barrier for immigrant families to applying, and so I want to just make sure that folks have as much information as they can to help really let people understand, what this is for. And so the application asks only for the information needed to determine eligibility for health coverage. People who are not seeking coverage for themselves will not be asked about their immigration status. And the disclosure of Social Security numbers for a person not seeking coverage for themselves must be voluntary and used only to determine eligibility for an applicant or beneficiary. Benefits can't be denied because a family or household member who isn't applying for coverage hasn't disclosed citizenship or immigration status. And the application information for individuals applying for coverage is verified through a data services hub that connects to immigration status, but the information provided by applicants or consumers won't be used for immigration enforcement purposes. So immigrant families who are individuals who are qualified non-citizens generally aren't eligible for Medicaid and CHIP for the first 5 years after receiving their qualified non-citizen status. So this is always referred to as the 5-year waiting period, which means that they must have a qualified non-citizen status for 5 years before they're eligible. There are some exceptions. For example, refugees and asylees are eligible right away. And individuals must also meet their state eligibility rules, including residency and income. So there's a lot to consider, but states have the option to cover lawfully residing children up to age 21 and or pregnant women under Medicaid and CHIP. So lawfully residing is defined as lawfully present and otherwise eligible for Medicaid or CHIP in the state. It's the same definition of lawfully present as it's used for Marketplace eligibility, so it includes more statuses than qualified non-citizen. And for this group, lawfully residing children up to age 21 and pregnant women, that 5-year waiting period does not apply. I'll also note that that 5-year waiting period does not apply for marketplace coverage either. If you're a eligible, a lawfully present, lawfully residing immigrant, you don't have to wait 5 years to apply for marketplace coverage. You can enroll right away. For those who aren't eligible for coverage through the marketplace, they're also not eligible for premium tax credits or the cost sharing reductions, or for most Medicaid or CHIP, barring California, which I think is the only one, or one of probably the states that are doing that. Undocumented immigrants may continue to buy coverage on their own outside of the marketplace through a broker or through a private health insurance company. Again, they're able to have access to the limited services through emergency Medicaid if they're otherwise eligible for Medicaid in the state. They are eligible for an exemption from that individual shared responsibility requirement, which most people know as the penalty for not having health insurance. So because undocumented immigrants are not eligible to enroll, they don't have to pay the penalty for not having health coverage. Undocumented immigrants may be eligible for other state or federal health programs. And for example, I know here in DC, the DC HealthLink, we have limited programs for people that they don't ask immigration status to provide services for. So there are local options as well to look into. For lawfully present immigrant seniors, so in talking about Medicare, because we have a lot of, for example, I know some in my family where my aunts have come over from Mexico, but they've never worked here, so they're not eligible for the free Medicare like we would know. So Medicare has different eligibility rules. For example, you have to have qualifying work history and immigration status restrictions. So some seniors, including legal permanent residents, may not be eligible for that premium free Medicare because they lack that qualifying work history, but they may be eligible for the premium, the buy-in Medicare. So the best place to inquire about this is by calling 1-800-MEDICARE. So seniors who are not eligible for premium free Medicare may be eligible for premium tax credits to offset the cost of a marketplace plan as well. And so there are options, but I just wanted to put that out there as well, to know that many of our families are multi-generational households, and so we wanted to make sure that we added our Medicare beneficiaries and Medicare eligible and our older Americans. So during open enrollment, in-person enrollment assistance is the key to helping the immigrant communities get coverage, not just the Latino community, but also in our Asian American Pacific Islander communities and African communities where limited English proficiency is a barrier. So we have a marketplace call center which is open 24/7. I don't wish the number was here. It's on the last slide, which I'll show, but you can call and receive interpretation services in over 150 different languages. It's very easy to get help and assistance in Spanish, and so you can call the Marketplace Call Center to enroll or inquire about eligibility. You can also find local help in your community by going to the website. If you want to call the Marketplace Center, the call center will tell you. You can ask them to help you find local help. But if you can go online or help folks find it, you can go to localhelp.healthcare.gov, and it'll prompt you to give you the city, state, or the zip code, and then it'll pull up a list of enrollment assistance centers and places that you can go to for in-person assistance. Again, language assistance is available through interpreters by calling the call center. We also have print and online web resources available in, I would say over 12 different languages. There are job aids available in 33 different languages to help immigrant communities complete applications. If you've ever been involved in enrollment assistance, thank you. And if you are interested in helping, and particularly this year as we have a shortened time frame, it'd be great to get more volunteers out in the community to help enroll people. If you'd like to help enroll, it's It's a very simple online application that you go to fill out your organization. If it already has a process in place to screen staff and volunteers, and you can ensure that you're going to protect people's personally identifiable information, particularly if you're already providing social services in the community, you're really well suited to help. All the training is web-based for the assisters. The online application is really simple. It takes like 2 minutes to fill out, and then we will screen and approve you within like a week or two, and the training takes like a week or two. So it's 20 hours of online training, and so it just depends on your staff and how many staff you want to have volunteer to enroll people, but the process is still there. It's still open. So if you go to marketplace.cms.gov, please do consider helping to volunteer this year. Again, here's the phone number. I was looking for the phone number for the Marketplace, the call center, the healthcare.gov call center. We call it the Marketplace call center. It's really the healthcare.gov call center. It's 1-800-318-2596. And we have interpretation services in 240 languages, so we've improved over the last couple of years. And here the resources are available. We have new healthcare.gov resources for the 2018 open enrollment period up on our website. So you go to marketplace.cms.gov, and we have posters, fact sheets, postcards, and things that now have the new dates from listing November 1st through December 15th of this year for the 2018 open enrollment. So I would encourage you to go ahead and check out the latest resources we have and get ready for this year's open enrollment. And again, you'll find here how to order CMS publications for free. So you go to productordering.cms.hhs.gov to order resources. Here are additional resources for immigrant families. So our federally funded health centers are a great place for undocumented immigrants and all immigrant families to seek health services. They don't ask immigration status. Medicaid and CHIP coverage of lawfully resided children and pregnant women. So this link will show you which states, and it'll take you to resources and links to find out which states offer and Medicaid and CHIP coverage in these cases. And I'll end here and turn it back over to Paul, and just leave you with our digital platforms, our Twitter, Facebook, and YouTube, as well as you can also sign up for resources if you go to marketplace.cms.gov. We have a listserv, or sign up to get email and text alerts on healthcare.gov/subscribe. So there are many ways to keep updated and to help, during open enrollment. Retweet us, share the Facebook posts, and share our YouTube videos with your communities.
Great, thank you, Jeanette. I do see one question for you in the question box. Can you access that?
I don't see it, the question mark.
I can read it.
Okay.
It says, do you have information on billing for tobacco cessation services in a behavioral health setting, not primary care?
I don't. I would assume that if the provider is Medicare designated or is billing Medicare, I don't know if that's the difference in a behavioral health environment or not. I know that Medicare covers all of the mental health and substance abuse and behavioral health services, and all marketplace plans are required to cover those as well. So I don't see how it might be different, other than the difference in maybe copay or co-insurance, if there is any.
Right. So, I'm guessing it would really be recommended to contact the health insurance plan to get their recommendation?
Yeah, because the screening and the counseling should be free and should be covered. So if you're referred by your doctor to a behavioral health specialist and it's within your network, then yeah, it's covered. but yes, you will definitely have to reference the particular plan you're on or with, even a managed care, Medicare managed care plan or a marketplace plan. You know, I would definitely check with the provider, with the plan first.
Okay, thanks. And then we have another question. If we could back up and show the slide on tobacco cessation that said how many face-to-face visits a person can have.
Oh yeah, the 8 face-to-face visits for the counseling sessions.
And while you're doing that, just a reminder to everyone, we will post the recording and the slides from today's webinar on our website, our network website, which is nuestrasvoces.org. So you'll be able to access this after we're finished. Okay, thanks. So it's up to 8 face-to-face visits.
In a 12-month, I guess, period.
Right. Oh, we have another question from someone here with us. Hi, Flor.
Could you explain a little bit more about premium buy-in for Medicare?
Oh yeah, that's a great question. I really don't know what the premiums are, and if it's like a set premium across the country, because I know every year like there's a slight fee. So Medicare, the free one, isn't really exactly free because you have your Social Security takes out, automatically deducts the part for Medicare, your premiums from your Social Security. So yeah, I'm not sure if there's a set national cost for that, but I do know that the rates are set every year and that they tend to go up or down, or in the past years they sort of keep going up.
Okay, so if somebody does not work for 10 years, they can be eligible and Social Security is gonna pay for it, right? Is that correct? Or?
Yeah, so the way it works right now is that your Medicare comes out of Social Security, and then you call Social Security to enroll, or you call us to enroll. But yeah, so I would recommend calling 1-800-Medicare to ask specifically. Sorry, I don't have that information. I'm not prepared with that. But there, or you can even call your Social Security office or your local office if you prefer.
Okay, thank you.
Great question.
Right. Are there any more questions for Jeanette? If so, if you could type them in your question box or the chat box. While we give people another minute, Jeanette, I had a question. So if a promotora is working in a particular state and they want to be sure about the cancer screening, preventive cancer screening benefits, I mean, my understanding is that they vary a bit from state to state. Where do you recommend they go to find out that information?
Good question. I would maybe try the Health Finder. Let me see if I can pull it up. But healthfinder.gov. Did I get that correctly? I better check to make sure. It's a HHS website.
Okay. Yeah, I mean, I know that they're somewhat similar state by state, but if a community health worker or promotora was putting together a presentation for a resident of a particular state and wanted to be sure that they had exactly the preventive benefits for cancer and tobacco, is there sort of like a one-stop sort of resource where you could look it up by state?
Now, I know of a resource that gives you the state cancer profiles. And I can go ahead and try to share this, but I am not. Oh, yeah, screening and risk factors. Okay, Okay, let me see if I can show this to you. There is the website. Do you see just the website? Sorry if you see my other parts of the screen.
We can see a couple of tabs, but it's highlighted on state cancer profiles.
Yeah.
So that's
yeah,
statecancerprofiles.cancer.gov.
Yeah, I would check there as a start.
Okay, well maybe we can include that in the information that we post on our website along with the slides for people after we're done. Thank you.
Yeah, I'm going to put it back on the thing in case I get embarrassing emails come through.
Okay. Yeah, so thanks again, Jeanette. I just had a few more things that I wanted to discuss before we conclude today. We wanted to share with everyone an excellent resource for low-cost healthcare services for those folks who that you discover aren't eligible for a government health insurance plan. For example, some people fall into the Medicaid gap. Others, as we've talked about, are here in the U.S. without documentation, which of course is true for some people in the Hispanic community as well as other communities. Or if they have a particular exemption based on personal circumstances, or if they can't afford their insurance at work but make too much to qualify for subsidies in the exchanges. So those are all different categories that people could fall into, and it's important to be able to direct them to affordable and culturally appropriate healthcare services in their communities. And of course this includes cancer screening and smoking cessation related care. So the resource that we wanted to share with you is a toll-free bilingual helpline called Su Familia, or Your Family, 1-866-783-2645. Su Familia is operated by the National Alliance for Hispanic Health, which is the parent organization that operates the Nuestras Voces network, which is bringing you this webinar today. Su Familia has been in operation for just over since 2001, so 16 or so years, and to date has assisted 127,000 individuals. In a nutshell, Su Familia provides free, culturally appropriate, reliable, and confidential health information and materials in Spanish and English to help callers navigate the U.S. health system and stay healthy. The helpline database includes over 13,000 providers around the country that's used to connect callers with low-cost or sliding fee scale healthcare services in their community using a caller's zip code. The helpline also assists callers with the health insurance plan enrollment process through the marketplace, Medicaid, Medicare, and CHIP. And it's staffed by some amazing bilingual health promotion advisors, including a medical doctor and a nurse, who provide basic health information on a wide variety of health topics over the phone, as well as through material dissemination after the conclusion of calls. Health promotion advisors are certified application counselors who renew their certification each year to assist callers with their health insurance application questions. They've been doing that since the Affordable Care Act launched in fall of 2013 or for preparation for 2014. Helpline hours of service are 9 a.m. to 6 a.m. Eastern, Monday through Friday, 6 p.m. Eastern, thanks Marcella, Monday through Friday. Calls received after those hours are returned the next business day. The helpline uses a case management model to support callers with tailored assistance to meet their specific needs. One thing that makes this particular helpline unique is that there is no time limit for a call. Which on average lasts 10 to 15 minutes, but can really run up to an hour or more, in addition to callbacks when additional research is needed to identify the most appropriate referrals for a caller. Referrals include not only culturally appropriate and sliding fee scale healthcare centers and health screening locations, but also referrals to organizations that can assist a caller with medical bills, specialty medical or surgical treatments, prescription assistance, and other social services to support basic needs. When it comes to tobacco and cancer-related services, these are also provided through Su Familia. Health promotion advisors can provide counseling on why tobacco should be avoided and the reasons to screen for certain cancers, depending on a person's gender, age, family history, etc. Referrals to local tobacco cessation support groups or behavioral treatments are also provided, as well as clinics that can provide nicotine replacement therapy and additional medications. Referrals are also provided to local clinics that can offer sliding fee scale cancer screenings for cervical, breast, colorectal, prostate, lung, and skin cancers. And really for cases where health promotion advisors determine that it's necessary for a caller to speak to someone at perhaps the smoking cessation quit line, Déjalo Ya or Quit Now, for more intensive smoking cessation support, or on the cancer side, if it's necessary to refer folks to American Cancer Society's bilingual cancer management helpline, we can do that for more serious cancer-related scenarios. They'll make those transfers as seamlessly as possible to those resources to ensure a continuation of care. So we really do encourage you to take advantage of the Su Familia helpline, especially when you're doing outreach in individual or group sessions with prospective health insurance enrollees, and really promote Su Familia as an alternative healthcare resource for those in the community who realize that they don't qualify for an insurance plan. Of course, also feel free to promote the helpline in general for everyone that does have health insurance and just might need more information about a particular health topic, or has a concern about their health, or needs to provide a referral in their communities. Let's see, are there any questions remaining for Jeanette or for myself? We're right at the top of the hour, so we can fit probably one in if there's anything else. Okay, well, thank you again for joining us today. A reminder that this recording and the slides will be posted on our website, nuestrasvoces.org. We'll be sending you out a short survey later this afternoon by email, and we really appreciate your feedback on that so that we can learn how to do these webinars better next time. Thanks again, and have a great rest of your day. Bye-bye. Bye-bye.